everyone, and welcome to Our Voices. I am Jeannie Niwa, and I am joined by my co-host Oriane Itangishika and Siminish Yekoye. We are also privileged to have a special guest co-host today, Linord Moudou. Linord is the host of English to Africa's Healthy Living television show and Health Chat radio program. Both are a weekly health news magazine program that address health and wellness issues of interest to Africa. Welcome, Linord.
Thank you so much.
So, Linord, I know you have been covering closely maternal and infant mortality. It is said when a mother dies during childbirth, the future dies with her. That's according to an annual Goalkeepers report by the Bill and Melinda Gates Foundation, which aims to track progress on the UN Sustainable Development Goal. This year's report spotlights the global maternal and newborn health crisis. It says across the globe, approximately 800 women die each day during childbirth. The chance of a baby reaching their first birthday dropped to less than 37% when their mother dies when giving birth. Although there has been significant progress in reducing global maternal and infant mortality, there are large inequalities in survival between regions of the world and countries, especially on the African continent. Today on Our Voices, we'll take a closer look at the maternal and infant mortality rates and examine some of the successful initiatives that have been put in place to ensure the survival of mother and child. Well, ladies, what is your experience on these topics? I know for me, this really touched, very closely because I have a cousin in the Congo who lost her child, who was premature in the incubator, and then there was no electricity, and unfortunately the baby passed away.
Is that in a city?
It was in the city. Yeah.
And it's the small things that that can take a life away, like electricity, not being able to just see when you're giving birth and when you're trying to help a woman give birth. So hopefully that
the issue of maternal health and infant mortality is something I've covered for many years, as you mentioned. One of the things that really stood out to me in this year's Goalkeepers report is the fact that maternal mortality rates have increased for the past recent years in countries like the United States and the United Kingdom. So a lot of times when we think about this issue, we think about women in the rural area, but it's not about being poor or being rich. It's just about being a woman.
Yeah, that's true. And I agree with you. The fact that even though it had declined previously, it's now coming back, and COVID and things like increased conflict also contribute because it's not only happening in rural areas, as you said, it's also happening in cities. And take Sudan, for example. Because of the conflict, a lot of health facilities has to partially suspend or completely close. And I remember saying a UN report saying over 4,000 pregnant women were at risk of death because they were not able to access obstetric care. So it's really sad, makes me sad to see that a woman can die because of giving birth at this age.
Right, and I'm glad that this actual topic is getting a little bit better over the years in Africa, but we still have some progress to be made, right? Yes. And I know you, Linord Moudou, have recently spoke to Melinda French Gates about the Goalkeepers report, which sheds light on the progress to avert maternal and infant mortality for women around the globe as part of the UN Sustainable Development Goals. And you began your interview and the conversation by asking her why they chose the maternal health crisis as their focus for this year's focus. Well, let's take a look and then we'll come back and dive more into it.
Well, we decided to bring this issue forward this year, the importance of maternal mortality and newborns, because the world has made so much progress on under 5 deaths of children, but yet that first 30 days of life, and in fact the first day a baby is born, is the most dangerous day for the baby. And we're still losing 800 moms a day to maternal mortality. So we looked at the data from around the world. We have a number of researchers. One of them is Institute for Health Metrics. And we said, this is data that people need to understand so that the world can do something about it.
According to the report, the world has the tools and innovations to prevent maternal and childhood death, yet these innovations are not reaching everyone. What are some of them?
Well, some of the innovations that we highlight are things like intravenous iron. There's a doctor in Nigeria who has come up with a way to do IV iron, which only takes 15 minutes for an infusion. And what we know is that it makes a woman less likely to hemorrhage during childbirth. That's a fantastic innovation that should be scaled up immediately. Azithromycin, which is a very common drug, something a lot of us use even if we get some other infection. It's low cost. It could be given to moms to prevent sepsis at the birth of a child. We highlighted one other thing in the report. We highlight 7 interventions, but another one is a very simple drape, a surgical drape that put under the mom right after childbirth that it's called emotive, that can literally measure how much blood a mom is putting out or hemorrhaging from to know whether the doctor or the obstetrician needs to intervene right then. So we look at these key interventions that can bring down the most death in women, and we make sure that all of them are ones that can easily be used in low and middle income settings.
And what can countries do to ensure that women in the most remote places have access to the care they need and to new innovations?
Well, several things that countries can do. One is they can make sure that there are enough midwives in the country that are well trained. They can look at their regulations to make sure that these innovations as they come out, this one that's coming out from Nigeria on intravenous iron, that it doesn't necessarily have to be a doctor that gives it, that it can be a nurse or a midwife who can give it. So changing the regulation of who along the chain can actually do the intervention, that's another important thing that can be done. Making sure that women not only know they need to get to the healthcare facility before they enter labor, but making sure the community knows and makes a plan for that. I've seen that done in Malawi, and it's made a huge difference that women get to the healthcare center early. They can learn about other things that can help their children and their babies, but then they're not caught in a rainstorm where there's no motorcycle available to take them. That's when they get in trouble in terms of the delivery.
Coming back to the SDGs, we are less than 10 years to 2030. How optimistic are you about 2030 when it comes to achieving goal number 3 on health, particularly regarding maternal health and infant mortality?
Well, I think, let's be honest, the pandemic set us back. We've seen maternal mortality rise in places. We've seen underchild deaths not being addressed because the health systems are fragile. They were already fragile, but then you put the pandemic on top. But what we're showing this year in the Goalkeepers report is we actually know how to save 2 million lives between now and 2030. So the 7 interventions that we talk about in this report, azithromycin, IV iron, a simple way of measuring hemorrhaging, a new ultrasound, a tiny little one that's coming out, these interventions can help save 2 million lives between now and 2030. So we want people to know, just like bringing down under 5 childhood deaths, I go like this because it was a graph of all those deaths coming down, it is possible to save these lives between now and 2030. And I think that progress will give the world more momentum to know we can save children's lives, and we need forward progress on this.
So what is your message or the main takeaway regarding the Goalkeepers Report 2023?
800 women should not die a day in childbirth. We can address this. We know how to address it. And we don't need so many babies to die on their first day of life. We as a world know how to save these lives. And guess what? Every life is important and it's worth saving.
This is the 7th Goalkeepers Report. Where have you seen the most progress and where do you think a lot more needs to be done?
Well, we saw amazing progress on reduction in poverty. We saw amazing progress on reduction in under 5 deaths, age 5 deaths for children. Now, the pandemic set us back, and we have to be honest about that. It wasn't something anybody in the world was expecting, but we're starting to see people, are definitely going back to the health system. We're seeing the health systems revitalize. So progress is possible. I worry the most, quite frankly, about gender equality. I see all over the world that places have made excuses and set gender equality back instead of the forward momentum, and that's the one that worries me the most.
Well, she says a mother should not die giving birth, and Well, reducing mortality rate is one of the UN Sustainable Development Goals, and these goals have been experiencing setback. They are falling short of progress. So did she talk about the setbacks to why reducing mortality rate is not being met according to the UN?
Think about it. Every 2 minutes, a woman dies while giving birth because of complications in the world. So she's very touched by this issue. And when it comes to setbacks, COVID essentially was one of the main reasons why a lot of women were not able to have the prenatal care they need, the attention they needed while giving birth, and the postnatal care they needed while giving birth, or after giving birth. So COVID was a very important part of the setback, as reported in the Goalkeepers report.
Yeah, she also talked about simple intervention, and I mentioned that at the top of the show, that sometimes they're just simple intervention that can save lives, and she said they're trying to save about 2 million lives by 2030.
Yes.
Do you think the simple solutions are simple on the continent?
It depends. As she mentioned, these are solutions that can be adapted in a low and middle income setting. That's why they are bringing this forward, because these are solutions that can help women even in poor setting. You know, when she talks about azithromycin, for example, is a drug that is commonly used for other diseases, and it's not expensive. It was even used for some people for COVID.
That's
during COVID. So that's something that women can have access to. Also intravenous iron, that's something that can be done. So really these solutions, they talked about 7 solutions. They are because they can be accessible to women in poor settings, they're really putting an emphasis on it.
Great.
I wanted to know, what is her contribution, or the foundation contribution, to those solution, invention? Were they founded by the foundation?
So as she talked about during the interview, the fact that these solutions are being reported in the Goalkeepers report is to really put them forward, make people aware of these solutions. The scientists, the researchers, and the innovators who worked on these solutions are, you know, some of them are Africans. So they are accessible. The foundation is putting this solution forward and hoping that countries can really take ownership.
That's great.
Thank you, Linord, for sharing your takeaways from your conversation with Melinda Gates. And we'll continue our conversation, but it's now time for a break. When we return, we will introduce you to a Nigerian obstetrician who is a researcher and who came up with a solution to postpartum bleeding or hemorrhaging for women who were never diagnosed at all. But first, we also love to hear from you on our social media platforms. We are on Facebook, Instagram, and X, formerly known as Twitter, and our handle is @VOA Africa. And don't forget to use the hashtag VOA Our Voices. We are also on WhatsApp, and our number is country code +1 202 503 9025. Don't go away, we'll be right back.
Health, wellness, sport, beauty, medical breakthroughs. Healthy Living cares about your well-being. What are the main health concerns in Africa and around the world? Find out the latest on coronavirus. Connect with our experts and ask them questions.
How long does the virus stay?
Join me, Linord, Moudou, in Washington every week on Healthy Living, right here on VOA.
Welcome back. You're watching Our Voices, and we're looking at maternal and infant mortality, especially on the continent, the African continent, and how significant progress is being made to preserve the life of mother and baby with a safe delivery. Now, we will go to Malawi, where a woman bringing hope to underprivileged women by founding a maternity clinic that has set a record in delivering more than 8,800 babies with not a single death of mother or Your Child for her efforts improving access to safe childbirth charity. Salima has become known as the country's midwife lifeline achiever by President Lazarus Chakwera in 2020. Lamek Masina reports from Lilongwe.
Grace Chakudza gave birth in November to a healthy baby boy, her fourth child, at Achikondi Community Clinic. It opened in 2008 to help poor women safely give birth. Since then, the clinic has performed more than 8,800 successful deliveries without the loss of mother or child, according to its founder. That's a record number in Malawi, where the United Nations Children's Fund says the average mortality rate per 1,000 births is 22 deaths for babies and 6 for mothers.
There's a big difference. There's congestion in public hospitals. Women give birth on the floor, and sometimes one nurse is responsible for 3 pregnant mothers. This compromises the health of mothers and children. But here, I received good treatment.
The number of successful deliveries reported by the clinic means it beats not only the global average of 17 newborn deaths per 1,000 births, but also the average of rich nations. Britain this year gave clinic founder Charity Salima the Commonwealth Points of Light Award, calling her Malawi's Florence Nightingale, the English founder of modern nursing. Salima credits the way the clinic handles medical emergencies.
All that success has come in because we can live where there is a complication as soon as possible. Early detection of any abnormality and any referral. That is what makes us to be successful.
The clinic is free of charge, and the building, constructed by donations from Scotland and the Norwegian Nurses Organization. The US-based charity Freedom from Fistula Foundation, which helps treat the childbirth injury, funds the clinic.
Before this clinic, many pregnant mothers were giving birth on their way to the hospital because of the distance they were traveling.
Despite their reputation, Salima says the clinic does have challenges.
Sometimes we lack resources. It could be financial resources. We don't have much resources. So as you know, we would also want, if we could have this building, like have a solar electricity, because sometimes electricity is on and off.
Salima hopes one day they can have enough support to open more clinics to spread their flawless record and help reduce Malawi's newborn and maternal deaths. Lamek Masina for VOA News, Lilongwe.
Thanks, Lamek, for that report. On Skype from Nigeria is Dr. Hadiza Galadanci, Director of Africa Center of Excellence for Population Health and Policy, Bayero University in Kano. She has dedicated her life to reducing maternal and child mortality rates. Dr. Galadanci has been recognized globally for her innovation in providing a solution to postpartum hemorrhaging for women in 4 West African countries who had never been diagnosed with a health concern. Dr. Hadiza Galadanci, welcome to the program.
A very good morning, afternoon, and evening to all our listeners and viewers.
Thank you so much. So, Professor, you took part of this year in Gates Foundation Goalkeeper Award ceremony, where they honored Ashumarta Yenti, a registered midwife, blogger, and founder of the For Mom and Baby Foundation in Cameroon. She was the recipient of the Change Maker Award. So it is apparent that midwife training is essential to averting maternal death, especially on the continent. Don't you? What's your take on that?
Oh, yes. Definitely we need skilled birth attendants. And the first skilled birth attendants are actually midwives. Even before you start talking about obstetrician, you talk about midwife, because midwives are supposed to take care of normal deliveries. Obstetricians are trained to take care of complicated deliveries. So we need to have enough skilled human resource. And we know that in Africa, one of our major challenges is actually the dearth of human resources, whether it is the midwife, whether it is the nurses, whether it's the doctors, whether you're talking about community health workers, you're talking about pharmacists, you're talking about all the healthcare workers. But key in midwifery skills, which is normal delivery and postpartum care, are the midwives. And we really need to have more midwives in the continent. Every single country in Africa will need to devise strategies that they will be able to train more midwives and have them all in our health facilities to take care of our women.
And Dr. Hadiza, this is Linord here. Nigeria is one of the countries in the world with the highest rates of maternal mortality. What seems to be the main cause for this trend, and what will it take to reverse the trend?
Unfortunately, maternal health is such a condition that you need a lot of strategies if you really want to get it well. So the challenges in Nigeria are enormous. So the first one is, for example, our poor girl-child education, because you need to have our women and girls educated so that they can utilize the healthcare system so that they can take care of themselves. So you talk about, girl-child education. And then when you come to the health system, in fact, before you even get to the health system, there are delays. I heard the midwife talking about, people coming in late. Mm-hmm. So we have people presenting to the hospitals very late, that even if you have the best of care, you will not be able to save them. So we have delays in decision-making in getting to the health facilities. Then you also have the issue of transport. Mm-hmm. I heard her talking about transport as well. So you can have a complication and you cannot get access to the nearest facility that fast for you, for your life to be saved. And therefore challenges of getting to the health facility. And then you have challenges within the health facility. And the first one is lack of human resource. We have a lot of challenges of human resource. And then you're talking about lack of commodities. You're talking about lack of utilities. I had her talking about solar. You can just have a complication, somebody bleeding, and there is no light. How can you save that person? Mm-hmm. And then you're talking about the quality of drugs and the quality of, consumables. One of the key drug that's supposed to save a woman from dying from postpartum hemorrhage is oxytocin. But oxytocin is supposed to be kept at a particular temperature. You need a fridge. Now, how many of our health facilities in the rural areas have fridges? And when they have the fridges, how many of them have lights? So you can see there's a lot of, challenges. It's not just a single challenge. If it was a single challenge, you would have solved it.
You raised really very important key points in terms of safe delivery, especially in rural areas and countries in Africa. But before we continue our discussion, let's hear from women in Uganda to share their thoughts on solutions to address maternal mortality. Our reporter Fahad Sasabagalia in Kampala talked to Doreti Amuron, Nakibuka Nur Musisi, and Fatia Kiange in Your Voice segment.
So we need to really tackle the issue of teenage pregnancies, because you'll find that even the boys who are impregnating the girls most times are young boys who do not know anything about healthcare, the importance of emergency care when it comes to issues to do with maternal health. And therefore, they will not take decisions seriously. When the right time comes, you'll find that children will be missing, for example, in most important immunization days. Women will not look after themselves in terms of pre- and postnatal care. And all these are contributory factors on maternal mortality, deaths, and also morbidity.
The other is to sensitize the women themselves on the need to take antenatal care within health facilities while pregnant, as well as sensitizing their partners and husbands to be in position to access the health services. Remember, one of the things is that women should be in position to access the services from the health facilities.
Mechanisms like weekly surveillance for maternal deaths, combined with skilling healthcare workers through clinical mentorships, also combined with equipping lower level healthcare facilities, because they handle the bulk of mothers who are going for delivery.
And in terms of resources, we need to invest more in the welfare of healthcare service providers so that when women need these services, they actually walk into facilities that are well equipped to manage any emergencies that could arise during childbirth and to save lives on time, because most of these deaths that occur within our health facilities or in communities are actually preventable deaths.
Perhaps countries within the sub-Saharan Africa may want to think about use of approaches like litigation to hold governments accountable, and precedents or judgments from the courts should be in position to be implemented.
Legal empowerment for communities, for the women, the husbands, everybody, the public, about their right to health, but also empowering the healthcare workers for them to be able to be responsive to the needs of the women, and for them to know that actually communities can hold them accountable. So those are some of the interventions that have worked.
Thank you, and thank you, Dr. Hadiza Galadanci, Director of Africa Center of Excellence for Population Health and Policy, Bayero University in Kano, for joining us. But before we close our show, Linord, as the host of VOA's Healthy Living and Health Chat, you had several opportunities to sit down with Melinda French Gates. She's glowing. She looks different. She's
definitely
way
glowing. What's going on?
More
Give us some insight. You know, she looks
empowered.
really
She's very passionate about her work and working in the field of maternal health and philanthropy. And you know, one of the things that she said during the conversation is every life is important and is worth saving. And I think it's really something, when you look at the Goalkeepers, you see all the solutions. And yes, not everybody can be saved, but some people can be saved. And that's where the report talks about 7 interventions that can save 2 million people by 2030. And really, that's where the message is.
Awesome. When you do something you care about, you do glow, right?
That's true. Yeah, it's a good look on her. Definitely. Once again, thank you, Linord Moudou, host of VOA's Healthy Living and Health Chat. It was a pleasure having you here in the studio to catch up on the latest episodes of Our Voices, or to stay up to date with news and from around the continent. Go to our website at voaafrica.com and on our YouTube channel. We will see you again next week with another exciting program. Be sure to continue the conversation on our social media platforms. Until then, thanks